Morning, Coleen.
Morning.
Thank you for doing this short interview. We talked a little bit about the HIPAA requirements and confidentiality and the fact that this will be used for educational purposes. Is that okay?
That's fine.
Good. What I'd like to do is just have you tell us a little bit about your story, about how you came in here, what was going on with your teeth and your bite, and we'll go from there. Okay?
Okay. I had lost my dentist of 20-some years and was being seen by substitute people while that practice was changing hands.
Mm-hmm.
And when I saw the dentist on my last visit there, she found a cavity in a tooth I didn't know I had had a cavity in, and did not address an issue with another tooth that was bothering me. And I wasn't really satisfied with the way the filling was handled, and so I decided to come to you on the recommendation of a number of people. And so when I came here, all my teeth really hurt, and I was using Sensodyne toothpaste, and I had gotten a soft bristle toothbrush and was just trying everything I could, and thought, well, I'm just getting older, and so my teeth are just getting terrible, and this is how it'll be. And anyway, so you smoothed down the filling that was here, ground down the crown that was actually bothering me, and that improved both of those situations. And then you took care of some aging cavities in my front teeth, which I asked you to do. And after you had worked on me for a while, you sensed that my jaw was really tight, and you asked me about that. And as we talked about it, I remembered that I had had an injury about 5 years back. Just someone had bumped me in the chin, and I had talked to my dentist about it then, and he didn't really address the issue, and so I just learned to cope with it.
What was it you were coping with? What did it feel like?
Well, it felt like it just wasn't in place.
Okay.
And I either had to keep my teeth clenched down all the time, or I felt like my jaw was dropping. And especially during the day, I never could be comfortable. But then at night, I always felt this dropping sensation. And it was like I couldn't sleep very well because I had to either be holding my teeth tight or feeling this falling sensation.
Did you have any headaches or muscle pains?
I didn't.
Okay.
I didn't have any trouble like that.
Good.
And several years back, I had asked my former dentist about TMJ because I was way back then having some trouble with my jaw. But that kind of, I don't know, subsided.
Went away.
And I never had any pain with
Okay.
this, but I just had this discomfort of never really feeling like it was in the right place.
Okay.
So when you mentioned the possibility of making the splint and treating it that way, I was very interested in that because I was not interested in having surgery on my jaw, if
Right.
that would be the other option. So I came in, and as you know, you fitted me with
Yep.
the splint. Then I think I came back a week or so later so that you could check it, and we adjusted it a little bit, and I don't even remember what that was for, but I didn't have any pain with it or any real discomfort. It was just that I think you wanted to get it situated,
Balanced, right?
balanced.
Yeah.
And so we kept doing that, and then I came in another week, and maybe I came back in 2 weeks or whatever.
Right.
And you told me to wear it all the time, except when I ate, so I did that. And the first day, I think, I felt kind of fatigued. You know, it just felt like I had something very big in my mouth. But that sensation passed over quickly. I really had no trouble wearing it. And after, I think it was after 3 or 4 weeks, I took it out one day, and when I looked in the mirror, I thought, I think I look different.
Yeah.
And I don't know if that was just, the placebo effect or what, but I had this sensation that something had changed. And then I started to notice that my teeth weren't hurting.
Okay.
And the longer I wore it, the less they hurt.
Okay.
And by the time the whole thing was over, none of my teeth hurt,
Right.
which was like a miracle. It was a total change that I was very, very thankful for. And then after I was done, then you marked everything and tried to grind down the ones that were still not quite
high.
right, because I had had many crowns over the years, and they were probably not all aligned just the way they should have been, and so it was amazing.
So you noticed some of your muscles relaxing, at least that you felt that they were relaxing, and you looked a little different?
That was the other thing too. After wearing that for 2 months, my jaw was in a place where it just was comfortable. So during the day, I didn't have to be thinking I have to either hold my teeth together or whatever. It's just I can feel it right
just
now.
there.
It's just a place that you don't have to think about at all until something is wrong with it.
Exactly.
So yeah, it's gone back to that.
Okay, good.
Yeah.
So then we did the equilibration and the balancing of your bite, and that was back in May. This is November, so it's been several months. How's that feel now?
Very good.
It feels
I
like
can
it's
chew everywhere, which I couldn't before. I mean, I had to be very careful where I chewed certain things. I can just, for chewing, it's great. For just around the clock, it's good. I wear the splint at night.
Yep.
And periodically, I don't know if I have a day when I'm just nervous or something, and I probably tighten up a little bit. I sometimes will have a little sensation of something isn't quite right there, and then you just recommended that once in a while wear the splint during the day, and
Sure.
so I've done that, and it seems to work.
Good.
It is, yeah. I think you said once it's like putting the jaw muscles on a little vacation or something,
Right.
and I think that's really true.
Yep.
So
Okay.
I'm very happy with it.
Very good. Well, Coleen, thank you very much. That's exactly what
Thank you.
We wanted to find out, and seems like it's going well, and everything is fine.
Yes, I never would have believed it. I think I told you at the beginning I thought it was voodoo.
Yeah, you were a little skeptical.
I was.
Yep.
You made a believer out of me.
All right, thanks a lot.